Hi, everyone, and welcome to the Community Engagement Series. My name is Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S. H. Leong Center for Healthy Children, as well as your moderator for the series. I'm incredibly excited to introduce our speaker for today's webinar. We're joined by Dr. Carley Riley, who's an Associate Professor of Pediatrics at the University of Cincinnati College of Medicine and an attending physician in critical care at Cincinnati Children's Hospital. She's also the Director of Community Systems at the Michael Fisher Child Health Equity Center and Director of the Mayerson Child Well-being Initiative. Dr. Riley's work focuses on fostering optimal and equitable health and well-being through community-led cross-sector collaborations. She's also an expert in well-being, social influences on health, participatory methods, community organizing, and system science. Her presentation today will describe strategies and practices for co-creation, and she'll be using an example from her own work in Cincinnati to shed light on this. So welcome, Dr. Riley, for joining us today, and I'm going to pass it off to you now for your presentation.
Thank you so very much, Priscilla, and thank you to all who are here today. I will note this is really extraordinary in that we not only have a number of new friends that I get to meet today as a result of this invitation, but I also bring with me many friends who have joined the conversation today from Cincinnati and other locations in the United States. And so very much looking forward to what this conversation will be. And with that, I'm going to share some slides. Let's see if I've done that. Fantastic. So you should see a title slide here in which I'm going to be really speaking about how it is that we here in Cincinnati are co-creating solutions for optimal population health and well-being. And as a part of this, I'm going to offer a number of different tools or resources that we have been utilizing here. Throughout, you will notice that there are tools where I will note that there's a tool and then there's QR codes. And hopefully those are all still active for you to be able to get to the resources that I offer. And then I know this is being recorded. But also we'll make the slides available in PDFs so that everything is available to everybody who would like them after the fact. And so our objectives here today is that I'll hopefully describe strategies, practices, and some considerations from our work here around co-creation. I'll identify a number of resources, mostly existing, but also some upcoming that we utilize to support and nurture co-creation. And then my greatest kind of ambition here is that we all can gain some insights together that foster hope, encouragement, and continued motivation to continue co-creating change. I will note that there's this wrench symbol on slides where I've called out specifically that there's a tool there that we use. And then most importantly, before I continue forth, I must say that this is the work of the heads, hearts, and hands of many, many, many over 10 years' time. And so while I get to be the one here speaking to this primarily, please know that I speak on the behalf of many who have lent themselves into this work with incredible generosity and intelligence. All right, so with that, let me leap forward into just grounding in a definition of health equity that we utilize here and that we lift up here and shows us how co-creation is absolutely necessary as a way of being able to achieve and sustain health equity. So this is the Braveman et al. Definition. You can find the paper at that QR code in which health equity means that everyone has a fair and just opportunity to be as healthy as possible. And that in order to achieve that requires removing obstacles to health, such as poverty and discrimination and their consequences, which include powerlessness and lack of access to good jobs with fair pay, quality education, housing, healthcare, and safe environments. Powerlessness is named specifically in this definition. And co-creation is just one way of ensuring that there is power sharing and power giving, and really the redistribution and reallocation of power in ways that will lend itself towards health equity. And so we really see health equity not solely as a what to be achieved, but really as a how, a way of being in order to really realize the state of being that we would like. And this concept of health equity was recently pictured graphically, opposed to equality, through the Robert Wood Johnson Foundation. And you can see the full discussion of this at that QR code, in which a few years ago, they posed these two definitions here, one of equality, in which everyone gets the same, regardless if it's needed or right for them. And then equity really is where everyone gets what they need, understanding the barriers, circumstances, and conditions. I utilize this as a tool for people who really don't understand like how co-creation is necessary in order to be able to achieve equity, to really in concrete ways explain it. Because on the left in that pink drawing in which everyone gets the same, we might imagine who may have been involved in creating that way of being, right? The sidewalk that has that sharp, steep end, the visual, simple visual, without any kind of other audio supports, nothing tactile in the environment that would signal anybody. So you can imagine that individuals who are visually impaired, who require supports in order to be mobile, maybe who are smaller, like children, they may not have been involved in creating that picture of a sidewalk. And yet that is what is given to everybody. To achieve equity, we necessarily need to involve considerations of the different needs of diverse peoples who will be utilizing that same crosswalk. And so you might imagine that we will have improved access within this neighborhood by involving the people with barriers to achieving safety in the prior model, including them in the co-creation of what the new sidewalks should look like. And as a result, we come up with things that are very helpful. Audio signals, the tactile pieces on the ground that signal that an intersection is coming, that ramp, which allows for better access for all individuals. And so really this highlights that in order to actually achieve equity, you need that process in which you achieve equity that necessitates co-creation with all of the users of the system. And with that, we also understand, and I'm sure I'm speaking to the choir here, that in order to really improve child health or health and well-being, it requires us to address the social determinants of health. Here at Cincinnati Children's Hospital, we say it necessitates that we provide optimal, equitable, excellent medical care and also address the social determinants of health. And here you can see the way that the United States in its Healthy People 2030 has discussed, defined social determinants of health and pictured social determinants of health here. And you can see that this is really about the conditions in which people are born, grow, work, live, and age, and that wider set of forces and systems that shape the conditions of daily life. And it's exactly these conditions that need to be shaped and reshaped through co-creative processes in order for us to really be able to achieve optimal and equitable health and well-being. I'll say here in Cincinnati, we do leverage this model, but we are really gravitating more towards the vital conditions for thriving framework now, which you can see at that QR code. And so in order to really co-create the conditions for optimal health and well-being, we recognize that we necessarily have to put the population, the community, Cincinnati's children and families at the center, and that we have to understand and appreciate that we have essentially surrounded them in our society with systems. A government system, an education system, a faith system, a food system, so on and so forth. That each of these, sectors are systems, right, that are contributing to the context that surrounds and shapes the lives of Cincinnati's children and families, and that these forces are active at the local level. But also here in the US, we talk about the state, region, and national levels as well. And so that socio-ecological kind of framework of different levels of influence is also really important for us to understand. And we recognize that currently all of the different systems work together to create the conditions around which the health and well-being of Cincinnati's children and families are created. And that as a result, we're getting the kinds of health and well-being that these systems are producing. Here at Cincinnati Children's, we repeat often, every system is perfectly designed to get the results it achieves. And so we recognize that right now, that collection of systems that are surrounding our population are perfectly designed to get the health and well-being that we are currently seeing within our own neighborhoods and our own populations. And so we often will kind of rebut the thought that a system is broken and say, no, actually, a system is working exactly as it is intended to. It is just deeply flawed if it is producing results that we do not want to see. And so instead of convening around a table and saying, well, what if we don't change anything at all and something magical just happens? Instead, we get to systems thinking and systems redesign, which necessitates co-creation if we're going to achieve real health equity. One of the other kind of tools that we use in talking about this is we talk about wicked problems. That currently the way that our systems are functioning has given rise to a number of different wicked problems that are really undermining and interfering with our ability to produce real health and well-being for all here in our local population. And a wicked problem is really defined as a social or cultural problem that's difficult or feels impossible to solve. Normally, that's because it's highly complex and it's interconnected. They often lack clarity, and then there's a lot of real-world constraints that actually make attempts at solutions very difficult. Now, wicked problems look like poverty, food insecurity, large kind of social ills that we would like to solve are really wicked problems. They don't have a simple solution. They require something other than traditional solution finding and traditional thinking. They really require us to bring systems thinking and systems change to bear. And once we start talking about that within and among communities, people can gravitate to that language. They say, yes, I see that. I can appreciate that right now we've been wrestling with a wicked problem of increasing gun violence that involves youth here in our local city. And that is a problem that has lots of different root causes, lots of different overlapping and tangled determinants that we're not going to be able to solve with just one simple solution. Instead, we're all going to need to lean in and tackle it. And because it's a wicked problem, it's going to be hard to do and require us to have not just co-creation now in the moment, but this longitudinal persistence in co-creation together. And so in order to kind of explain to all of the different interest holders who need to come together in order to really co-create effective solutions, we utilize this diagram, which has a story behind it, in which we place an elephant at the center of a space. And then we bring in these scientists who are all blindfolded. And it is their job to figure out what is the hole in the room. And each of these is placed at a different part of the elephant, or what ultimately we're going to call the system. And you can see that this one individual at the front is feeling something very sharp and says, it's a spear. I have been able to ascertain with what I can appreciate that what we have here is a spear. Well, the person up on the ladder is feeling something solid and says, it's a wall. And then the poor individual who's been unfortunately placed near the rump reaches out and feels that tail and says, it's a rope. And when we start talking about it like this, we can say an elephant is a really big problem to solve. And each of us has a unique position along and around the elephant. And we can only feel or experience what is immediately in front of us from our own perspective. And we can offer that up into the room. What could happen then is that people begin to argue. It's a spear. No, it's a wall. It's definitely a rope. And they start to convince the others, right, that what they are experiencing is the whole truth. That is not co-creation. That will not get us to a real understanding of the whole of the wicked problem, and it will not get us to creating effective solutions. Instead, what the people surrounding the elephant need to realize is that they each can only see or experience the piece that's right in front of them. And so together, if they were able to map out what they all were seeing together, they would begin to come to an appreciation of what they actually have here in the room as an elephant. And what's really important is that people who are the users, the experiencers of systems, students in a school system, residents within a neighborhood, patients within a healthcare system, they have a really critical perspective of the whole that must be included if we are going to really understand the entire and then co-create solutions together. Tapping into an image like this really allows people, at least in our experience here in Cincinnati, to begin to let go and welcome in the idea that, okay, we're actually all in this together. I have an important contribution, but so does everybody else, and we need to work together in order to get somewhere. And so what we've been striving to do over the last while is really knit together the different systems, sectors, and the organizations and people that comprise them into a community learning system in which the people that whose lives are being shaped by these systems are really placed at the center. And so a community learning system is made up of the people, the organizations, the businesses, institutions in a community. And what we've appreciated is that those parts produce the outcomes of the community, including the health and well-being of its people, as well as its economic vitality, as well as its recidivism rate. A whole host of other outcomes, desirable and undesirable, are produced as a result of these systems. To really become a learning system, though, these parts of the community must work together like a network. That's when you start to see those ties, where they are sharing data, co-creating knowledge and action, aligning their incentives, sharing their purpose, and creating that culture of continuous improvement. This is a model that we have brought over from the healthcare system here in the United States, where we developed this way of solving wicked problems within the healthcare setting by creating learning health systems. And it's been really effective in improving safety, as an example, within our hospital systems. And so we thought this is something that we may be able to then bring over and a model that we could bring into community. And it absolutely demands co-creation in order to be effective. And so this is what we're doing at the most fundamental level, is creating a community learning system in which co-production or co-creation, more specifically, is really at the foundation of what we are doing. And we're doing that recognizing that in order to create real improvement in health and well-being, we need to do that across all levels. Community change through people-powered movements, organizational change, policy, and then also societal and narrative change. And the way that we've been organizing ourselves here in Cincinnati right now to do that is that we are doing that in 6 different kind of buckets or work streams right now within priority areas that the community itself has expressed are necessary for us to be able to achieve thriving here. Community safety, food equity, economic vitality, housing equity, importantly, sense of belonging, and then also community contribution. And in fact, these 2 pieces are so core and fundamental that that sense of belonging and community contribution not only are areas of work in and of themselves, but also must be woven throughout and across all of the other areas of work in order for us to be most effective. And we've organized this work this way behind the vital conditions for thriving. And we've elevated these 4 of the 7 vital conditions for thriving based on a co-creation process in which we've really begun to understand what are the key elements that we need to lean into first in order to be able to strive towards greater well-being, greater health, greater thriving for Cincinnati's children, youth, families, and communities. And so our highest outcome here is thriving children and youth. We have multiple different measures for that span across multiple sectors. We know that this necessitates that these children and youth live within thriving families and homes. And in fact, it is our family partners who have underscored this to us over and over and over again. Children will not thrive unless their families thrive, unless their parents thrive. And so that becomes a core part of our work as well together. And that these all must be nestled within thriving communities, supported by thriving organizations, within a thriving society, supported by thriving systems. And so this is really like our theory of change here, moving from that how through the what to our outcomes, from our community learning system through our drivers to ultimately our outcomes. And as you can see, co-creation is absolutely essential, fundamental to all of this. And so as a result of that, what we have done is begun to catalog our practices and our processes in co-creation and started to figure out when we're doing this, what works? What should we keep doing? What should we shed? What gets in the way? What are great examples? What are some bright spots of how we're doing this? And we've been able to produce a couple of things that I give to you today as offerings. One is an article, The 7 Practices for Pursuing Equity Through a Learning Health System, Notes from the Field. And these are practices that we've now also brought over into all of our work outside of the healthcare system as well. You can see those 7 practices listed there. And I'll say we have spent a great deal of time in particular working on leading from lived experience, that co-design and co-production, and then that reallocation of power piece, all which are very critically linked and necessary for co-creation. Importantly, I will note that this article was produced out of a partnership among academic, clinical, and community partners coming together. We also created a guide. This is the first element of kind of our series of like, how is it that we can begin to kind of write down and codify and share what it is that we're doing here when we get started in really co-creation. We started out thinking more about co-production and have moved much more towards that like all-inclusive concept of co-creation. But here we were really looking at equity and co-production. This is freely accessible at that QR code. And I'll describe a few of the pieces that are in this in case it would be helpful to you. First, we really recognized as we were doing this that there's something very special about being ready for co-creation. If an individual or a team or an institution or organization are not really ready for co-creation, it's not going to work. But readiness felt like something that was kind of unclear. People felt ready because they wanted to, but they didn't necessarily know that they weren't yet really actually ready to be doing it. And so we have some sections in this guidebook in which we talk about what readying yourself and your team looks like. And in this is a lot of discussion around grace and humility and learning and making mistakes and being transparent and building trust, but also a lot about being generous and about listening and about really centering what matters. In this section of the guide, we offer up definitions and background information. We've anchored everything within trauma-informed principles and practices. We offer reflection activities, as well as some tips to be practiced and applied. And then measurement tools and guides. At the very end of the guide, we have a team science and psychological safety assessment, as well as a co-production readiness tool that teams have been able to utilize to understand where they are on their readiness journey and what do they need to do in order to get themselves really prepared. One thing that we found is that teams have recognized that they don't always co-create and co-produce well amongst themselves yet, let alone then inviting other interest holders into a process for real authentic co-creation. We then have kind of cataloged what we think is this journey for co-creation in what we lovingly call a coffee stain image, in which we start with that preparing and exploring phase, moving through engaging and building together, and then ultimately into a support and sustain mode, recognizing that there are on-ramps and off-ramps and kind of chutes and ladders across this entire journey. So it's not necessarily a straightforward journey. The language and the questions that we lay out here are very Cincinnati Children's specific, as that was our first audience, but you could imagine adapting any of these questions to your particular context. We have found this to be an image and a mental model that wide sets of interest holders can really hold together and that we can come back to time and time again as a result. This is that process map. We also have in the guide some spotlights of case study with examples of co-production. It was really helpful to others here who said, I need to understand exactly what this looks like in reality for me to be able to appreciate it and move towards it. And then again, we have a measurement tool and guide, specifically a maturity matrix across the different dimensions of co-creation that will allow a team working together to kind of understand where are we right now and what would the next kind of level of deepening our co-creation practice look like. And then here in the United States, it's been incredibly important to us that we advance racial equity. And we recognize that co-production, co-creation is a way in which we can advance racial equity, both in the way that we're working and then in the outcomes that we're able to achieve. And so we have elevated a tool that we did not create, but we have utilized, which is the racial equity map that has a glossary of terms that allows us to kind of level playing fields in some of these conversations that we're having around racial equity. It also, we offer up reflection activities as well as measurement tool and guide, specifically the racial equity map, which may be useful to many of you in your practices. And lastly, I'll say this guide also includes some recommendations for how do you move to action and what are some considerations. And it was really important to us that we use as much plain language as possible, something that's challenging for us academics because we like our wonky words. And so we've really tried to work deeply with our family and community partners to provide language that is really kind of accessible, meaningful, and then usable. And here's just one example of a reflection activity that we have included in this guide that can be done at an individual or partnership or team level. I hope some of these are helpful to you. Now I'm going to give you one example that essentially everybody from Cincinnati who's in this workshop right now has contributed to over the last many years. And this is the co-creation that happens within the system to achieve food equity. This is something that I would have previously said was an emergent learning network or learning system here in Cincinnati, but it has now been sustained now for nearly 5 years. And so I can say we have a community-based cross-sector family and community-centric learning system focusing on food equity with the global aim or vision that all 70,000 children in Cincinnati will have the food that they need to grow, develop, learn, and thrive. I'll explain a little bit about our origin story and then show you how we utilize co-creation to get where we are today. So the origin story, it started back in March 2020. That is when the COVID-19 pandemic really first arrived here in Cincinnati. Our governor for the state of Ohio placed stay-at-home orders in place. And so people were not to show up to school buildings. People other than necessary workers were to stay at home instead of come into work. And really transportation, all sorts of things changed such that people had much less access to basic needs, which is already a problem here in Cincinnati. We have a very high rate of childhood poverty here in our city, and in certain neighborhoods, it's essentially endemic. And so we already were dealing with a great deal of food security prior to this crisis. And then we knew now that there were going to be families who were essentially shut away at home, fearful, and without access to the things that they needed. And so we asked ourselves here in Cincinnati, how should we respond? And at Cincinnati Children's, out of our community-based work, one of the first things that we did was we turned to the families themselves and our community partners. And this is a tool that I offer up. We turned first to them and asked them a series of questions. What are your needs right now is one of them. And we tracked over just a little over a week's period of time, 43 different families, to gather information from them to really give us what our North Star was going to need to be. And what you see here is a Pareto chart in which we then logged the frequency of responses. So the response that was most frequent is on the far left, social connectivity need. And that was 13 of those 43 families expressed that as a need that they had right now. And another question we asked was, and in the near future. And so social connectivity was an area that we knew we needed to respond to if we were going to be responsive to what our families and communities were telling us. Food was the second most frequently cited need, and rose when we then asked about the future. People said, I might be okay right now, but 6 months from now, I'm really worried about what state our family will be in. And so we had never done work in food security, but we immediately turned our book of business through this co-creation process to say, this is what we're going to be working on now. And then we had to say, and what does that mean? How do we show up? What does that look like? And that we also co-created with others. So first, this is one of the first things that we did. This is one of the first outputs you're seeing right now back in the spring of 2020. We started showing up on phone calls that were being convened by a city council member, Landsman, who's now a congressman here, in which there were over 100 interest holders in our food response in Cincinnati, convened on these calls, and they were sharing all sorts of information with each other. And we decided, in working with 8451, which is the data analytics company that powers one of our largest grocers here in the United States, we worked with their data analysts to prepare these maps. On the left, you see Cincinnati and its neighborhoods with shading from a light beige to a very dark brown based on childhood poverty rates within that neighborhood. The darkest colors are the areas with the highest childhood poverty levels, and therefore where we anticipated the highest level of need. We then mapped over that the food distribution system that was going up, mostly on the backs of the school system here in Cincinnati, and then drew a 1 mile walking radius in green around each of those. And we brought these maps forward and asked the interest holders if they were willing to all have a shared purpose of ensuring that every single child and family would have free food available to them within 1 mile walking distance at least 3 days a week. And everyone said, yes, that is a minimum goal that we should seek to achieve. And we said, great. Where those dark brown areas are without green, those are areas where they're not getting any. Within 3 days, major distributors changed their distribution patterns in order to flood those areas with food, build the necessary system to be able to sustain that over time, creating new relationships. And those relationships still exist today. And so what we saw was, wow, we have a large number of people who all have different roles, who share a common purpose and change their behavior in response to data. That sounds like an emergent learning system in which co-creation can be possible. And so we leaned into that. We started creating together maps of food distribution sites because our community members and family partners were saying that would be really helpful to them, and started to create a more organized emergency food system, again, with parents and caregivers themselves at the center. As we began to kind of mature this way of working together, we borrowed from the different elements of a learning network or learning system and adapted those with community organizations, community partners, and family members into kind of a language and toolkit that we would use then within our community-based network. If you wanted to learn more about learning networks, you could grab that QR code there on the lower left. But this is the language tagged with our very pretty apples that we utilize to say, this is how we're working, and these are the ways in which we need to work in order to be able to create a better now and a better future. I will pause for a moment and just say that is the beautiful logo that was co-created with community members and a designer for the SAFE network. And there's deep meaning within that hand figure with the apples in the basket. Upcoming, there's going to be a handful of tools that will be released. And Priscilla, I'll make sure that you have access to them and can distribute them. One is we're currently testing a community learning system maturity matrix with 8 different domains across which a community learning system needs to mature in order to be most effective, with co-creation as one of those domains. A neighborhood as a system toolkit, and then a neighborhood learning network model. In this work, within the food equity work, we built heavily off of this coffee stain model in terms of the process to create co-creation with community. And we really leveraged our training in community organizing strategies. Multiple of us have taken courses with Marshall Gantz and his community organizing approach and theory, and we applied this. And one of those ways, really simple. I had a lot of conversations one-on-one with a lot of people by phone, by Zoom, with masks, with coffee, talking about our shared interests and exploring whether or not leaning into a smart aim where we were to improve food equity within priority neighborhoods together and actually measure that over time. Would that be something that they would be interested in? People leapt out of the woodwork off of this burning platform and into this work very readily. But we use these one-on-one relationship building moments to not only gain that kind of buy-in, but also to explore what role would you want to have? What would this look like to you? How could you see this being beneficial to you or your organization over time? What is it you would need from me? And we were very kind of organized in how we went about doing this, and then immediately acted upon commitments in order to see who was actually going to be able to lean in and lead during this time. We held convenings. These were mostly over virtual platforms at this time because of the COVID pandemic, but we brought together community members along with small community organizations to really hear their voice around building a shared vision for what this work could and should be. And out of that came our true north, along with our initial areas of action. And then we kept ongoing relationship and trust building through multiple different mechanisms. One is our community engagement specialists have either built or leveraged existing neighborhood leadership teams within our engaged neighborhoods to hold at least monthly neighborhood leadership meetings in which people who have resources or power or ideas or money can come together with the neighborhood residents themselves and exchange ideas, co-design, co-produce together. And those monthly meetings have continued on and have been a place where interventions that are chosen by the neighborhood end up getting refined or evaluated over time, and where the neighborhood itself has really built a tremendous amount of sense of agency and power. And now they're asking to move beyond food. We want to do more with our neighborhoods and more with our community partners to improve well-being in our neighborhood in other ways as well. We also hold an annual Safe Network Summit where we bring together all of the different partners, look back on the year that we've had together, talk about it openly. What went well? What didn't go well? What did we achieve? What should we celebrate? What didn't we achieve that we wanted to? Why? And then we look ahead and figure out what our strategic priorities and plans are going to be for the year ahead. And during that, we're able to make decisions together, like how is community going to define measurement? What does success look like with our own communities, defined by our communities with regards to this this wicked problem? And self-reported food security became something that was really important. We didn't want to just rely on objective measures like numbers of pounds of food delivered into a neighborhood to really know if things were having an impact. We wanted to know from the people themselves what their experiences were. And so we got together grassroots teams who went door to door and recruited people into a pilot test of a weekly survey that would go to people's cell phones and emails. We then started to track data over time together, and that's what you're seeing here. This is population data, all of the neighborhoods that are engaged with us, and the number of meals that are missing above that green line within that neighborhood over time. Getting that red line as close to that green line as possible is what success would look like. You can see that in these three neighborhoods that was achieved for a period of time during the early COVID-19 era. But then over time, we started to slip away from closing that meal gap. And once inflation and the SNAP benefits which is our food program here in the United States, rolled back at the end of the COVID pandemic, you can see that we're now missing a whole host more meals in these neighborhoods than we were before. And we have a lot more insight as to what's really driving food insecurity within these neighborhoods, and then what we together need to do in order to address it. And we're not only looking at these data over time overall, but also by neighborhood at a neighborhood level. And so different neighborhoods are pursuing different solutions and have access to different resources and assets. So we're trying to learn together what may be solving something in one place that then could be borrowed and shared over into another place and space. What's one problem maybe that one neighborhood can't seem to solve that maybe another neighborhood might have a suggestion for? And so creating that opportunity for cross-neighborhood learning as well. And we share these data through a publicly available data platform that you can access through that QR code. I will tell you, it looks much better on a computer than a smartphone. But there's lots of different elements that are being built into this platform that is publicly accessible. And we're going to continue to build it out with our improvement efforts, as well as bringing in voice of the community and more qualitative data as well. And all of this we have wanted to build out in a way where we are continually encouraging more and more distributed leadership. This started from a very centralized place, a handful of people working together, but inviting others in. And we really want to create, now that we're, almost 5 years in, much more of a distributed leadership governance structure. This is the first one that we tried on a few years ago, where we had essentially modeled ourselves off the American government of the judicial, legislative, and executive branches that are all tied to each other, each serving a particular purpose for the other, with a neighborhood leadership group really at the top. And you can see their responsibility to this network. And then the blue lines, kind of what it is that they are providing to the other areas of our governance structure. And then you've got our food initiatives. They're in green. And then the safe stewardship group, which is essentially those that don't live in the neighborhood and aren't providing food themselves, that are providing more of a stewardship or backbone function for this endeavor. And we utilize a whole host of tools to try to really make what we are doing accessible, visible, apparent, and that so that people's words and contributions can be readily seen and appreciated. And one of those ways is through graphic recording. And so each of our summits, we have a phenomenal graphic recorder coming from Columbus, and she essentially depicts the conversation of that entire day and then the output from it. This has been utilized not only during the meetings itself as a way of kind of creating that sense of I'm being heard and seen, but also then gets disseminated broadly within all of our materials. But then we also have organizations and partners who say, I want to include this in my grant proposal as an example. And so then it becomes something that supports their individual work in achieving more funding. Our website there is down on the right, and you can explore there more. Lots of things are available there. Here are a handful of them. We've got a couple of publications that you might find interesting. Academic publications is part of our currency. It's also one way that we get to share with others some of the things that we're learning and some of the things we're having a harder time with, in hopes of us collectively being able to get better and better. We've been producing reports each year that not only talk about what we've done, but more importantly, how we're doing it and where we're looking to go to. And then there's that dashboard again. And then at the bottom, this was our most recent summit. Look at that collection of just phenomenal smiling faces who had spent an entire day coming together, looking back and looking forward. And so we recognize that every system is perfectly designed to get the results it achieves. And so we're working to co-create a cross-sector community learning system perfectly designed to produce equitable thriving. And so that, I say thank you so very much. This is my contact information. Reach out for anything. And I would love to drop the slides here and invite in reflections and comments, questions.
Perfect. Well, thank you so much for such an incredible presentation. I was taking notes down of all the different resources and tools you were highlighting in your presentation so I can actually go back, Carly,
Mhm.
and take a bit of a deeper dive into them, specifically within my role at the center. But at this time, I would like to ask if anyone has any questions to either raise their virtual hands. You're also welcome to leave your questions in the chat for our speaker, and I will surely bring them to her attention.
If I may, Priscilla, I also invite, we've got lots of folks who are part of this work. If any of them have anything that they would like to add or reflect upon or lift up, I'd like to welcome their voices in as
Yes, absolutely. I definitely have a question for you,
well. Please.
Carly, just to get the ball rolling. I noticed that we do have some trainees
Mhm.
on today's call, and in preparation for today's session, we had chatted a little bit about some potential questions that may be percolating in our minds about the
Mhm.
topic, your presentation for today. And one of them I think is really well pointed around the advice that you would give to researchers and trainees who are new to the co-creation process. What sort of would you impart on them?
Um, a number of things. One, having been a trainee at one point in time who was very new to this, so speaking from my own pathway, but then also we're a training institution as well. And so we continuously have trainees who are coming and working with us specifically because they want to learn more about co-creation. So our team has a lot of experience in supporting people. And a few things that I would offer up. Um, One is recognize that it is its own skill set, its own area of expertise, its own art form in some ways. And so while some of the elements of it may feel very human and should feel like they should be very natural, in fact, because of how we've been brought up and trained and grown up, many of us actually don't have access to those skills or those mindsets and frames that are necessary for really authentic co-creation. And so at first, anticipate doing a lot of unlearning, a lot of self-reflection, a lot of observing, and a lot of mistake making. And knowing that this is a process in which there is going to be early on a fair amount of mistake making, ensuring that you're surrounding yourself with people who can support that process for you. I had the great benefit of learning from some of the pioneers in co-creation here in the United States. And I look back at how they surrounded me, they coached me, they corrected me, they put me out into spaces in which I was going to make a mistake, but then created safety within that. And I really am so grateful for them. And that is what I strive to do as well. So find people and places and contexts in which you can, with your own humility and grace, begin practicing, knowing that you're going to be receiving that kind of coaching to bring you along. I'll also say it's just one of the most extraordinarily rewarding things that you can possibly do. That learning and unlearning and then being with people in this way is really like sacred and privileged. And so while it's hard, and it's humbling at times, and you're going to make mistakes where you feel awful, and then you're going to recover and move forward, the journey is so worth it. And then in the end, you produce real results that matter in people's lives as a result of having participated in that co-creation process.
So incredibly well said. And I'm glad that you highlighted, Carly, that it is messy business.
Mhm.
There's always something to learn in the process, but just how incredibly rewarding it is
Mhm.
to, bring to fruition, an intervention or some sort of tool, whatever it may be, that addresses the needs and priorities that, months or, a year in advance you had heard from those around the table that needed to be
Mhm.
addressed. Like it is a very difficult experience to describe, and the emotions are really tough to describe as well.
Mhm. Yeah, and it requires that growth mindset, which is one of those practices we called out. If someone moves into this with a fixed mindset, this is rough because then it becomes about your character. And it's not. it's really about kind of reshaping your mindset and your heart set, in order to be able to be like effective in doing this kind of work.
Absolutely. You've touched on it already, so I'm going to take the lead in asking a second question too,
Hmm.
while others perhaps are percolating ideas. Again, please feel free to raise your virtual hand or enter your questions or comments in the chat. We talked about it's a messy business, and we learn from those experiences and take that forward with
Hmm.
us to the next opportunity. Are there specific challenges that you'd like to highlight that you faced in the past when, going through the process of co-creation with a particular group? But how you went about addressing or overcoming those specific challenges, I think would be really interesting to highlight as a lesson learned from
Hmm.
this session.
Oh, there's so very many of them. Um, I think two have come to mind to immediately, but first I will start with one of the challenges that I have had to navigate and that our team has really had to navigate is understanding kind of our own identity as coming out of an academic institution with its own culture and ways and priorities. Understanding then as we move into co-creation with others who are not a part of that same culture or hold those same values or ways of being, that we need to work on how it is we kind of shed those, but then offer up our capabilities and capacities, but then are able to come back into our academic institution and to those individuals explain like the value and the importance and the what it is exactly that we're doing. And so I think it's these people that are like us that sit at boundaries, right? That I think is an underappreciated set of challenges and then skill set that we have because we need to be like authentic, right, across all of that. Really, but really understand how is it that we can understand the frames within each and show up in a way that like speaks and honors them. Does that make sense?
It does very much so. I live, breathe, and eat in this space. So it definitely speaks to me in some of my current experiences, and hopefully, in extension to those on the call, this is resonating with them.
And I'll say some of the ways, and I would love to hear from any members of our team who also have recommendations here, because this is something that we work quite a bit on, um, um, is figuring out when do we do something kind of down low and underneath and underground until it's at a point where we can bring it up and present it, right? And when is it that we really need to elevate something? When is it that we use the currency of each, for the other? I would say strategic planning is kind of one of those spaces which actually creates the most tension, I would say, because our institution wants us to strategic plan in the way that it understands strategic planning. And it wants us to produce budgets and artifacts and things like that that are of the way it works. And yet, in order to really be doing co-creation, we have a very different kind of timeline and a very different kind of process, and often a very different kind of way of thinking about what success looks like. And so we've had to work on what is it that we choose to elevate up into a strategic planning process for our institution? What is it that we use those opportunities to bring them along? Like, what are the pieces that we actually use to say, hey, and this is what we're really doing, and this is why that's really important? And then, what are the areas in which, we sort of uh, put put pauses on and say, we're going to have a different kind of goal here. Our goal is not going to look like a goal that you would have inside the hospital or inside this institution. The goal is going to look like this because we need to honor that time and process over here. And it is going to be worth it because in the end, this is what we're going to see. And so that's just one very concrete example that we come up against time and time again, in which we're speaking directly to the values, wanting to utilize the resources of, and yet it's a very different culture and timeline.
Perfect. Oh, I see your hand is raised, Constance. Go ahead.
Yeah, I'm part of
Connie.
Carly's team. Hi, everybody. And I just want to like just add on to
Hmm.
what Carly has brought forward. And so when thinking about um, wrestling with that, when do we go public and when do we kind of pull back and fine tune? One of the key concepts that we kind of hold to when balancing those two spaces is to really like start small and start with a small intimate group that will be very honest and transparent with us and give us real-time feedback on when we get it right. We need more of this, less of this. So just recognizing when trying to mitigate, when we think we're not quite there, quite right, look to our trusted circle and start small and then look to get that real time feedback in order to make sure that, okay, how do we advance? How do we move forward? So.
Thank you so much. Two thoughts came to my mind as you were speaking. Well, three. One is like, yay. But second thought was the principle that we also hold of just showing up generously, right? And so that's the first, second, third, fourth, fifth thing that we do is we just show up in generosity and it's and offering. Um, and then the third thing just went out of my brain, but it will come back. Oh, is building culture in our teams, and then in that broader work of like radical candor and radical acceptance. And so Connie is someone who I know will speak truth to me, whether she thinks I'm going to like it or not, because in the end, it serves the purpose, right? And so that really sets the foundation for us being able to really move into this kind of work together, because I know when I'm making an error that I'm going to hear it. And I'm going to have the opportunity then to course correct. And I say that I personally, but I just mean also like our team at large, right? As we get signals from different places or spaces that we're either moving well or not moving well, we can speak openly to that in a way that nobody takes it personally. It's all about the work and the mission, and we all recognize this is hard and that we're all in this together. And that's pretty spectacular to be able to accomplish that, but it's something that I think you have to strive for.
Fantastic. Thanks, Constance, for chiming in and Carly for adding a bit more to that. I think that's excellent piece of advice for those on the call who are working away at, co-creation within their own respective projects, is to think about who they're surrounding themselves with and doing it in intentional ways of making sure that those folks are really invested in providing that critical, constructive feedback to move these initiatives in good ways forward, so that there is no harm and that we're in fact, meeting those initial objectives of filling those gaps around needs and priorities. So I'm too am going to take that away with me and share that with others who were unable to attend today's call with respect to their project. I think it's very good advice. I just want to do a final sweep from those who are on the call. Are there any additional comments or questions you would like to pose to our speaker today?
I do have one other related reflection if it's helpful. So if no one else has something, I'm going to kind of tie together some of the things that we've just talked about over the last 15 minutes. And for those that are relatively new to co-creation or you're in training, your first big mistake with a partner is a massive opportunity. And so having recently coached a number of different individuals through the, oh my God moment, I just did that. And you go, hold on, this is where you get to show your true self. And showing up then in that moment in a way that is humble, receptive, amend making, allows you then to actually create a deeper, richer, more nuanced relationship and learn a lot more about each other than if everything had gone along smoothly. And so like the bumps are actually the good spots. And if you can reframe them that way in your head, and they do smooth out over time, but early on, recognize that when those things come up, don't run from them, lean into them.
That's such incredible advice, Carly. I'm glad we captured that in this recording because I feel researchers needed to be reminded of that, myself included, that we should be coming at it from a positive lens to uptake that opportunity and move forward with it. So in that spirit, I would like to thank Carly for joining us today and leading today's conversation around co-creation and sharing a little bit more about her incredible work in Cincinnati. For those on the call, thank you again for attending today's community engagement series. I certainly look forward to seeing you all at our next event. Stay tuned for those details, which will be released in our upcoming newsletter. And I want to wish you all a wonderful rest of the day. Thank you.
Thank you so very much.